Hey. All right. Speak Easy podcast listeners, I'm excited for this episode because this one is one that is really geared towards, I want to say, all generations. And I know that I have certain episodes that are like geared towards some of the younger generations, some of the older ones. When we talk about pain and pain management, there are people in all the generations, all the age brackets that kind of look at pain as I can push through it. And that can be a very dangerous thing. And so that's why I'm excited about this episode, because as entrepreneurs, we feel like, oh, let me just push through the pain to get this done. And a lot of times we can cause more damage. With that being said, I'm excited about my guest for today. Hello, Dr. D. Terrence. How are you today?
Good afternoon, good day to you. I'm not sure which zone you're in, but how are you out of this? It's a pleasure for you to have me today.
Most definitely.
For this interview.
This is going to be a great one because I have some questions, but I also, I think that this is going to be one of those episodes that's going to shift some things for some people. Because we do have that mentality, that grind and hustle mentality that try to push us past, the pain. And man, I've seen many people on the other side of that get really hurt.
I hope it does.
So let's start with you telling the studio audience a little bit about yourself, and then we'll go ahead and dive into today's topic.
Well, I'm a board certified physician who's been practicing for more than 25 years. I'm board certified in physical medicine and rehabilitation, as well as being board certified in pain medicine. So those are my main board certification. In addition to that, I'm an author, best-selling author. I've written 3 books. One is called the Opioid Epidemic Consumer and Consumer Guide. The other one is called the Foster Opioid Classification Guide. And my most recent book is called the Stress Book, 40+ Ways to Manage Stress and Enjoy Your Life. And that's a comprehensive book about stress management, which is the book itself has won more than 20 literary awards. So that's in part some of my credential. I'm still actively practicing, and I have a pretty busy practice that focuses on pain management, stress management, and also helping people to find better ways to cope with pain and stress.
Now, it's interesting because as an influencer, I get products from different companies. And something that came through was, now I know I'm saying this wrong probably, kinesiology tape.
Oh, kinesiology.
I knew I said it wrong.
That's okay.
Okay.
I say a lot of things wrong sometimes out of this, so that's okay.
Okay. And it caught me off guard because what it is for Speak Easy podcast listeners, because I know you can't see it, but what it is, it's a tape that you're supposed to use for, I guess, for more range of motion if you have like a pain or something when it comes to joints or muscles. And I was like, is that teaching us to push through the pain? Like, is that a good thing?
Well, yes and no. I mean, there's certain taping procedures that are done, and they're fairly simple, where you tape the way the muscles are aligned or in order for them to contract effectively. And you could tape in certain directions, and that helped to reduce pain and also create certain feedback that allow our brain to process things differently. Now, is all of that allowing us to work through the pain? I said yes and no, because sometimes what happens is that there's so many people who are in pain, whether it be significant pain or minor pain. And sometimes some of those people will invariably decide that, you know what, I'm in pain, I'm not going to do anything. I'm just going to sit here until my pain goes away. Well, what that often do is that those scenarios often result in a situation where you're not doing much, you're immobile, you're sedentary in your activity, and therefore your pain levels tend to increase. So we do expect as pain consultant pain physicians, sometimes for patients to not let the pain control them, but for them to control the pain. And if you allow yourself to be in a situation where you will not do anything because you're in pain and you're looking for absolute relief of pain, then that may not be a realistic situation in all cases. There's some cases when your pain will completely be taken away, be disappeared by treatment. But there's some where it's striving for just to bring your pain to a level where you can function satisfactorily. So therefore, you're not saying, okay, I won't do this, I won't do that because of my pain. On the other hand, I also have to say that pain is a good indicator that something is not right. So sometimes if your pain is to the point where you believe it's intolerable for you, then you need to seek medical attention because you don't want to work through a pain that is going to be detrimental to you. So you have to strike that balance. And if you're not sure, try to get some advice because that will alleviate or prevent things from getting worse by you trying to say, well, I'm going to work through my pain when in fact you're doing the wrong thing. So there's a balance there. But the key factor is if you've been followed by a physician or by your therapist, physical therapist, kinesiologist, they can also help guide you in terms of how best to manage your pain. So it's not one case fit all. Everyone is different. There are lots of similarities, but there are differences in so many of us.
I love that you said that too, because we still are in a place in a space where a lot of people still shy away from going and talking to their doctor about what they're actually going through.
That is so correct.
You know, some of it is out of fear, some of it is out of what we've seen passed down from generation to generation. You know, you just try to figure it out. And the worst one is wrapping duct tape around it and just keep going.
Right. Yes. And, you know, we all have to be careful. You know, I think some of the fear is it's a multifactorial issue where some people will suffer through not just pain, but other medical conditions where they just fail to seek treatment because sometimes you're afraid of what are the possibilities that they're going to be facing. So then they want to prevent that. And unfortunately, not doing anything doesn't cause whatever problem you have to just automatically go away. Some problem will go away over time, or maybe masked by other things. So the key factor, what I would say to people, if they're going through a situation, whether the pain or any sort of medical thing, where they feel, you know what, I'm just not feeling right, then don't just sit there and go through it. Seek medical attention because a lot of times the result you get or the response you get from your doctor is more beneficial than that. And here's something. Let's say, for example, worst case scenario, you're having a potential diagnosis of cancer. Nobody wants that. And you're saying, well, I don't want to find out because I just don't want to deal with that. Very often there are cancers, many cancers are treatable or depending on the stage at which it's diagnosed can be completely cured. But then you have to do something in order to get to that point. You don't sit and wait and say, you know what, I don't want to hear, I don't want to deal with it. So go get treatment. That would be my best advice to anyone. Duct tape, that doesn't work for most people.
Okay, so definitely a no for the duct tape. All you dads out there that try to put duct tape on everything, it's a no for the duct tape. But you said something that was really powerful. Not doing anything doesn't make it go away.
Correct.
And I want to make sure that the Speakeasy podcast listeners like really caught on to that because that resonates in life and in business.
Oh yes, absolutely, absolutely.
Like if there's that fear and you just don't want to, you know, face it. That's understandable, but not doing anything does not make it go away. It doesn't make it shift or change into something else.
Yeah, some of us will and you mentioned a good point there, life issues. Some of us will have situations in our life we believe, well, you know what, I'm not going to do anything. I'm just going to sit here. Well, that's actually making a decision not to do anything. So by our inaction, we are actually making that decision that whatever comes our way, that's what we're going to accept. But there's a better decision often when we can take intentional action, intentional decision to make things better, find ways to do that. No, we may not have all the answers, and sometimes we don't, but that's okay also, because we can make the decision based on the information we have at that time. And whether that's getting medical treatment, whether that's getting a different perspective than where we were before, that also will help and put you in a direction, in a frame of mind where you're going to be also probably less pain, stress-free, or reduce stress one way or another. Things can be better by the fact that you've taken intentional action, intentional decision. Because a lot of us don't like to do that. We don't like to face challenges. We don't like to face conflict. We don't like to face anything that seems like it could make us be in a position where, you know what, we can't cope. But that's definitely not a good way to go.
Whoo, that part right there. It's interesting too. I know that you've been in this industry for quite some time. And so you've seen so many different things advance, but then you've also seen some things that you're like, I wish we could have some forward motion in these areas. What's the thing that really motivates you to still say, I'm going to stay in this industry because of what I can do?
I think when I went into pain management or pain medicine and the whole field of rehabilitation, I looked at something that I could do that I could enjoy. And also at the same time, provide meaningful and beneficial help to patients or people that are in need of medical care. And this is one of the things that I realized I could do and do it well. You know, I am somebody who is very practical, meaning in terms of hands-on technical. I love fixing stuff. I love doing that. And, you know, so instead of being in or choosing a specialty where I'll just write prescription or just, okay, send somebody for referral, there are things that I could do. I'm what you call an interventional pain doctor. So I don't just prescribe medication, but I also do interventional procedures, which is fun. I also do electrodiagnostic study, which is another test, a nerve test that we could do to our patient. And we do so many other different procedures in our office because I love doing things hands-on. So that's one thing. And those things are very often, you could see the objective value of them because you could see the actual result of those. Sometimes, and not that when you do all the things you don't, but sometimes when you're treating somebody for back pain and you're able to say, perform certain procedures and they come back and they're so happy, you're taking them from a state of where they were in pain or where they were so immobile or limited function to one of a better level and a higher level. And that to me means a whole lot, to just be a part of that sort of transition from, okay, this is where you were, this is your new better level that you're going. And that is something that is important to me and I love that. And, you know, I could still do a lot of the other things that other doctors do and still enjoy the practice of medicine. So that's one thing. There's downside when, you know, there are some people you at your best effort will not be able to help. And we as physician, myself included, have to realize that regardless of our best effort, some people, for whatever reason, whether it's social, economic, or their own person, we cannot necessarily do much to help them. And sometimes we have to let them know that and then move on. And sometimes they themselves have to make life-changing decisions. Some are willing to do that and some are not. And for those that are willing, it makes the process easier. For those that are compliant to what the protocol is of how best we treat them and how best we can help them, then those patients, those individuals, they're going to do much better. They're going to gain more out of what we can do for them.
Oh, what has been your most memorable experience so far?
My most memorable experience, that's an interesting one after this. I don't know. You know, I've been fortunate in a lot of ways to have good outcomes in what I do. And, you know, I give thanks for, you know, being to great medical school, the School of Albert Einstein School of Medicine. I've had practices that have been really educational. I'm just continuing education. So those things have helped keep me, what you call a more compassionate doctor. also know that I have limitations. And because I know that I have limitation, I am not afraid to reach out to my colleagues and ask them, well, what do you think? What is the best option? Or some patient I may not be able to treat, but I will know the best option or at least seek the best option in order to help them. So those things have helped to prevent some of the memorable things, good or bad. Good things, as I said, is some of what I just talked about. Love to see the progress that patient have made, love to see the impact of it. But one of the things that often is a challenge for us as pain doctor is to see what's happening out in the street with narcotic and the number of deaths that are occurring from overdose use of opioids. And sometimes as a pain doctor, people tend to believe that it's coming from the pain doctors, but the reality of it is that the vast majority of those deaths are prescription that are not written by pain doctors, but are primary care physician and other physicians out there that are not necessarily, some of them are not doing exactly the things that they should be doing. And some of them are just trying to be helpful, but are not doing it the right way. And, the training that we've gone through as pain physician has helped us or helped me in so many ways to do better and to find ways to improve. I mean, as long as we all realize that whatever we're doing in life, there's always opportunity to grow, opportunity to learn, and we never get to that point where we know everything. Because what? There's new research every day, new ideas, new method, different ways of doing things that we have to be open to learning more. We have to be open to letting other people teach us as we teach them, and to learn from our patient, learn from our staff, and all those things make us better as providers. And that's some of the things that I could say are, it's not necessarily memorable, but it prevented me from probably having some of the memorable things that are bad and having more good things as I look back on what my life as a physician in the career of pain management, stress management has been.
Oh, wow. It's powerful because when we think about, of course, in today's society, we have what we're looking at, the Grey's Anatomy, and we're looking at the different shows. And so we're like learning different things. But of course, it's an entertainment perspective. So it's not all true, but we are getting to learn different things. But I think another piece of it is that we get to learn the heart of doctors.
Right. And that is true. You mentioned a point that they tried to make it, some of those shows as real as possible. But the other thing, as you said, it's an entertainment. So if it's all real, then some aspect of that will just not be ideal for television. Because if you're a television producer, you want to produce a program that people want to come back and see. If it's something that there's all good outcome, then of course, people don't like good news. They love some of the bad news, the gory stuff. Okay, I got to see that. They want something to make them get up and rush home to their television. Okay, this program is going to be starting at 8 o'clock. I got to go home. So we can learn a lot from those shows, but often they have to go out on a limb to get their ratings up. They have to go out on a limb to make sure that they are providing entertainment. So we have to, as consumers, have to differentiate between those two. What are they trying to tell us? And can we as consumers differentiate between what they're trying to tell us is entertainment versus what is real? And if we can do that, we're a step ahead of the crowd. And these are the days when there's so much information everywhere. The challenge is that a lot of people do not have the foundation knowledge in order to process some of these information. So what do? How do they, come to terms or to decision about certain things? They go on the internet, they look at stuff, but sometimes they're so way off because they don't have the foundation knowledge. And that's where we as professionals, have to try to educate them, try to bring them into the right focus, because sometimes they're really going off on a tangent. And without the adequate knowledge, then that becomes more of a challenge, not just for them, but also it exposes them to being at risk to having injuries and doing things that they shouldn't be doing. You could find a chat room, you could find a group to tell you about something, whether they know what they're talking about or not. It's not uncommon.
Yeah, that I understand that because we could go to WebMD and everything is cancer.
Yeah,
Everything,
yeah. Mhm.
we're dying from everything. You got a hangnail, you have cancer. It's like you have to be very careful.
Right, we have to be, and that's the thing which we as a physician and as a provider and just as a consumer, because I'm also a consumer as a physician, so I'm not just a medical doctor. So sometimes I've got to buy stuff, I've got a primary care doctor. So, but of course the advantage is as a medical provider, I have a greater sense of what is more acceptable versus what is not, compared to say someone who is, doesn't have the medical foundation, or at least not necessarily as a foundation as a medical doctor, but just have some basic medical stuff to understand what is going on. So we all have to take that step to learn more, read more, and do more research, because a lot of people don't read as much as they should. And if they do read, it's just little snips of here and there. They may, okay, read a few lines here, move on. And, it's like a 30-second concentration in that. I just don't have the time for this. Let me just move to the next thing, whatever that is. But we have to spend more time reading, and we have to spend more time learning about the things that are important, not just to us, and learn in depth, not just a cursory view of things, but also try to find more information about the things that will affect you and can affect you, because you'll be in a much better place, in a much better frame of mind to deal with life and to deal with all the challenges that comes with life.
Man, Speak Easy podcast listeners, this has been an amazing episode. And I know it went by so fast. I know. But you can reach out to Dr. D. Terrence if you would like to find out more information. So let them know how they can reach out to you and also where they can find your books.
Okay, so my website is just as my name, dterrencefoster.com. And once you go to my website, you will have links there apart from the first page that takes you to all my books, take you to I'm also involved in nonprofits, so take you to my foundation. And you could find us about everything. In terms of getting the book is available in 4 formats: electronic book, paperback, art book, and audiobook. So that's a good range that allows people who do not want to read to listen to things. And it's of course is on Amazon and wherever books are sold. So all the options there are Amazon's, but you could find it at numerous book places. The book has been out. Most of my book, well, all of my books have been bestsellers. But my latest book, the Stress Book, 40+ Ways to Manage Stress and Enjoy Your Life, has won over 20 literary awards. And it's just been amazing. And it has just made me really, really humble and very indeed feeling very fortunate about the success of not just that book, but the other books as well.
Oh, I love it. So guys, definitely make sure that you reach out, get a copy of the books, read them, you guys, even if it takes you just reading a chapter a week, a chapter every other day, whichever way you have to do so, but make sure that you're reading them and implementing what it is that you're learning inside of the books.
One of the things about the books that I've written, most of them you don't have to read chapter after chapter. You can choose a chapter that's more pertinent to your situation. They're all connected, but they're not. You don't have to say, well, I got to read chapter 1, 2, 3 to 20, or or chapter to whatever the number of chapters in each book. You could actually take a section and read it, and you could get a lot from that because they're compartmentalized into different sections, and that easier for people.
Oh, that makes so much more sense. Thank you. I appreciate you selling that, because I know some people were like, oh, I feel like I'm about to go back to college. Like I'm about to see the textbook.
Well, if they check the website out, they'll realize, just based on the reviews that are there, some of the professional reviews, as well as they'll see that the book is written for consumers, most of these books. Okay. And it allows them. So I try to not make it so much where there's a lot of medical jargon or concept that the average person cannot understand. They're written in a way that most people even with basic education, could understand, what's in there and what is required of them. And that's one of the goals I have, to do that so that people can benefit more from what I'm doing.
And I'm definitely sure that they appreciate that for sure. So make sure, again, get the books, read it, implement it, y'all, because that's what it's all about. You being able to elevate in life and in business. And trust me, pain and stress come with entrepreneurship, but learning how to be able to manage it, to how to be able to categorize it is very important. So with that being said, you guys have a great rest of your day. And until next time, don't forget to press it out.
Thank you so much, Dr. Lee, for having me. It's an absolute pleasure. Thank you.
It was a pleasure speaking with you.